Hello everyone, this is Alraies from CVI 22 in Denver, Colorado. I'm really privileged to have my friend and colleague, Manoj Thangam. He's an interventional cardiologist and he's been a frequent visitor to CVI and one of the early emerging career physicians. How are you doing?
I'm good. Thank you guys for having me. It's a privilege to be here.
Thank you. So Manoj, CVI every year, last year was a COVID, we didn't show up, but why is it different than the other meetings? What brought you here?
That's a very good question. So I think the formatting is one thing that's unique, and then the intimacy of the actual meeting is very different.
Right.
So one, I think a lot of the times in some of the bigger national meetings that we all end up going to, it's often a little bit of a structural issue where you have the first 5-10 minutes of people reiterating some of the basic components of things that we've kind of heard and we've heard and we've heard. So in the 4th, 5th, 6th, and 7th iterations, it's kind of a little bit less value added, but could be useful, but I think sometimes maybe not as much as we were looking for. But the formula here really seems to be working like a charm. Every transition's give me the meat. I don't really need to have the wrapping. I don't need to have anything else. What's the meat? And people just jump from one valiant, interesting aspect and point to the next, and how they are pertinent and relevant to the overall theme of things.
Exactly, yeah. So it's pertinent, technical, didactic, to the list of pie charts and p-values.
Yeah. Not those are also very important, and I believe in those. I do outcomes research for a reason. I love that aspect of things. But it's very nice to have something where you talk about the real-world application. And that's sort of, in my opinion, the basis of what outcomes research ends up being, right?
Absolutely.
Because there's a discrepancy between real-world application of technologies and clinical trial data for what technologies could be.
Yes.
Right? It's great. It's like every kid. You have the potential to be the next Einstein, but maybe not everybody will be the next Einstein. Like every RCT that tells you have the potential to change everything with one advent technology or implication of a technology. Then you realize people may use that technology as salvage therapy, which is very different than what an RCT has suggested.
We just had an interview talking about using a PFO to close LA closure, LA appendage. So it's kind of... It wasn't in trial. This patient would never be randomized. They would never be approved for trial. But again, it works. It's safe. Why not?
Well, it's like AngioVac or AlphaVac. So in our program, I'm at Central Texas Cardiovascular in the Dell School of Medicine. We have a pretty nice peripheral program, a pretty nice PE program and PERT response program, if you will. And one of the things that you really just don't have the ability to start off doing is why would you go after a tricuspid vegetation or something of that sort? And then you have something that got developed into a technology where right now it's indications to go after a tricuspid vegetation because somebody was crazy enough to take an AngioVac, go into the venous system, go next to a bed and say, what happens if you suck it out? On somebody who is certain to die if you do nothing.
Yes. Yeah.
So I think some of that, and CVI kind of inspires people to be a little bit more, I guess, innovation isn't necessarily the right word because it's a part of it. I think more of it is just being open-minded to alternative applications that very well may be something useful and may have a place, right? I think
as long as you have the education and as long as you are safe and you have done it before, why not?
Yeah. I think that's kind of it's a little bit more of a like a cowboy mentality, which coming from Texas is kind of nice to see on a national platform instead of where are your RCT approved indications.
Exactly. You never find this in any books or any trial.
Absolutely.
Manoj, I think always pleasure to see you and your dynamic personality in the meetings. Really appreciate your time and your input on CVI. Please watch this video and others on CVI YouTube channel. This is Alraies from Denver, Colorado. Manoj, thanks so much, man.
Thank you so much, Pat.
Thank you.